So, woman comes in, she wants to get it off her hips.
Yes.
Like she's got it on her hips and her belly. She's about 40 pounds overweight.
Yes. Well, I'll tell her that this is not, again, it's not a weight reduction procedure. If we could reduce the weight a little bit more, so that this way, the amount of fat that we remove, so hopefully it would show that okay, this fat is removed and she's looking better. I had a patient who went to some place, and then actually there's another procedure called cool sculpting that they get actually removing the fat by just cooling it. And this girl had this much fat on her belly, about this much. With the cool sculpt, they can give it up about an inch. She paid, I think, quite a lot of money, and then come back, and they promised her an inch, and she got an inch. But that inch really didn't do anything for her, because it really, she didn't get what she wanted, which was a nice flat abdomen. And for her, I think the best thing would have been that you lose some weight, and whatever left we can do, or let's go have the major liposuction with probably a tummy tuck.
So, okay. So you might have sent her out to someone who would do the surgery.
Yes, I mean, I don't do, if a person comes to me, like you said, like 40, 50 pound overweight and a lot of fat, I refuse. I turn them down. I say, well,
maybe I can get a little bit, but you're not going to be happy.
You're not going to be happy. I'm not there just to go and remove and just to go through the motions and then not get the result that I wanted.
Okay, so it sounds like maybe 10 or 20 pounds overweight might go along with having a little extra fat, whereas if they're more than 30 or 40, it might be harder.
Yeah, it's not the weight, again, because it's the shape. Right. If somebody, even if is overweight, and then she hates that little bulge under the bra, because every time that she wears the bra, we can do that. But I will tell her, okay, this is just to get that end of the bra out. This is not for weight reduction. This is just that area that you don't like. We can get that done. So again, so weight is not as an issue. Is not really an issue. Is the shape. What kind of a shape? If you want.
So it's not your weight. It's your shape. Now, the reason I mention weight is that people with certain amounts of extra weight are more likely to have extra fat.
That's correct, and most likely will not benefit from what we are doing here.
Right. So that was my only reason. I really do know the difference.
That's true. That's true.
If I could take whatever extra weight that I lost and put it on my butt, I'd be very happy.
Well, that's what they've done, actually. That's what it's normally when you're going to have the big liposuctions. That's what you do, because they take your own fat from wherever that you don't like it and put it where you want to like it. You want it.
It's important to know if this is a good procedure for you or not, and they come into you and you talk about it.
Yes. Our consultation is complimentary. Patient come in.
Oh, that's great.
Yeah, we're going to just consult and tell them exactly whether you're a candidate or not. And if you are, definitely we could do it. And if you're not, we'll be very gracefully say that, okay, just don't do it, or go to do the real thing.
Do you have the major one and still have a little and want to work with you?
That's a good question. Yes. Yeah. Because when you go lose it or we gain back some areas, I could do that, yes. And some patients who have been there and then they did it, but suppose they did the abdomen and then they were happy with the abdomen, but again, this little area is left, so we can go ahead and do that. The area under the brow or the left handle, yes, we can do that. The area which is already liposuction, if it's done properly, usually should not. Sometimes you do need another one, depend, because if you need a little bit, yes, I could do that.
So you brought up something interesting. If you do the liposuction, and let's say the person's only got a little bit and perfect candidate for you, does it come back?
90% of the time they don't, because they're happy with what you do. Occasionally, because some reason, whatever reason, that the amount of fat which I remove is not enough, at the time that I'm there and doing, I said, okay, it's enough. And then when I see them back a month later or 2 months later, they say, well, I wish I moved a little bit more, removed a little bit more. Then yes, I would do more.
So that you answered a different question, but it was an excellent answer to another question. What I was wondering about, once you remove it,
Yes.
does it come back to that space?
No, that's a good question. No, because the way the fat works, once the fat cells are done, you're done. They
don't
don't come
refill.
back. Yeah. The way when we gain weight, we get more fat. Is the same fat cells which get fatter. So the cell themselves get fatter, swell up. So you don't produce new cells. It's the same cell which gets fatter. So if that cell is removed, then you don't get on that area which the fat was removed. It goes to other places.
So here's how it works.
Yeah.
Okay, we're going to take the fat off those places you don't like. And you know that spot where you really wanted some more? Eat up. Eat up. It's going to go to those spaces instead.
Yes, yeah.
Would it?
Yes, it does. Actually, it happened that some of the people who have had liposuction in the belly, and then later on they get fat, it goes to their butt, or they go to their back and the shoulders and other places, yes.
How long does the procedure take, from one to another?
Yeah.
Is there downtime, and then how long to recover?
Yeah. Procedure itself, it takes about an hour and a half from the start to beginning, because we have to look with the local anesthesia and all that. Sometimes maybe up to 2 hours. No downtime, but except some bruising, and you've got after the procedure there will be some discomfort. We need to tell the patients to bring one of those abdominal wrap, so when they come in, so we want to wrap it around after the procedure. And one of the reasons is that because anywhere, like when you get hit, you swell up.
Right.
Same thing. So this is
stop
trauma.
swelling.
This is trauma, injury. So when we take this thing, all the fat out, we're creating a trauma. We try creating a wound there. So what the tissue does, it swell. So it brings more water and more fluid.
Right.
That's why we want to put this area tight. When it is tight, less water and less fluid comes. Because what will happen if you allow the water to accumulate there, and then later more proteins and all that will leak in it, and it becomes a gel there. So now you got rid of the fat, but now he says, "Oh, doc, it's not working. It's still there." So it's not fat anymore, but it's a thick layer of jelly protein, which is kind of formed that. And now you ended up with that same thing under the chin. So it's very important that when we do that, we have to make sure that we wear that tightly, nicely for a while, because otherwise now still the typical patient says, "Well, it didn't work." It did work fat. It's not fat anymore. Now is the scar tissue and then that jelly.
So what about the thighs, the inner thighs?
Same thing could happen. So we put in those wraps. You've got those tie wraps when the tennis player and all that, they put those things, you put it around there.
So what if I did my love handles?
Abdominal wrap again, we'll wrap it there so you can keep it nice and tight.
Very, very, very interesting.
Yeah.
And so how long does it last? Forever?
Yeah, it lasts forever unless you gain weight. But
if
again,
you
it doesn't come in that area. It goes to the other area. That's correct. So it's forever. One of the good things is the other thing on the downtime. There's no other downtime. You can take some Tylenol. You can take some. We asked them not to take Advil or aspirin. The blood thinners for at least 72 hours to 4 days after that, because we want to make sure that that bleeding issue is gone,
yeah.
And then you can take any kind of painkiller that you want.
So if I'm considering this, what else do I need to know? What have we left out?
Basically, we covered everything, and another thing that we didn't cover is it painful. Otherwise, as I said, it's really not painful. Because it's all under local anesthesia. Sometimes, occasionally, when the tip of the cannula goes in a place which is still not very numb, you might get a quick little sharp pain. But otherwise, you can feel it going back and forth because you're awake. You're gonna be.
It's pressure.
Yes, pressure. But no pain, a little discomfort, but no pain. So it's not a painful procedure. Yeah.
I mean, why wouldn't you do it if you're concerned? How costly is it, by the way?
It depends how many areas we want to do, how much fat we want to remove. But again, like a regular liposuction is between $7,000, $8,000, $10,000, $12,000. Here we are talking about less than $3,000, around $3,000 or less.
That's awesome.
Yeah.
That's awesome. What are we talking about next?
I was thinking of maybe we can do some talk about each procedure, each conditions like melasma, rosacea, acne. I think maybe we can talk about those things.
and other things people come for.
Yeah.
So I'm just kind of curious. You've been doing this now for a while. What are the most popular things people come to you for?
Oh, for sure the fillers and Botox, that's number one, because such easy procedures and such a low hanging fruit that you can do it in such an easy comeback, few injections and you look fresh and good. Those are the most common, and the laser hair removal is a very common procedure. I mean, that you can do.
And that's for face?
Face, legs, Brazilian, back, men's back. Sometimes the men get it because they don't like to shave
That part of their face.
part of the face. They want to grow a beard, but they don't like it here, so you can do that. Ears, common man has a lot of ears. I've got a few people.
Nose hairs? No, I'm kidding.
Nose hairs I can, because the tip of my machine is not small enough to go inside the nasal cavity.
Oh, look, there's an invention.
Yeah, we should make a smaller one to go inside the nose. Yeah, well,
I don't know.
yeah. But something, a nose hair, we need it. We can trim it because it filters basically. That's
Right.
the reason. That's filters.
Right.
The hair in the chin, I don't think we need it unless to look good, or the hair in the
Right, it lengthens your face if your face is
yeah,
tall or
yeah,
something.
or the hair in your legs or private parts. I don't think that you need it.
And what do you do with it? I mean, useless.
Exactly.
Anyway, listen, I look forward to talking to you next. We'll talk about various conditions.
Yes.
And that sounds like a great idea. How do people get in touch with you?
Again, they can call us 201-569-0920, or they can go to our website, Englewood cosmeticmedicalspa.com.
Excellent. Well, we'll see you soon.
Thank you.
Thank you, sir.
Pleasure.